All right, so hello guys. My name is Michael Wayne. I'm a rising sophomore at UPenn, and for as of right now, I'm going to be just briefly talking about my project that I did. So over the summer, I participated in this program called PURM, and so in this program, what we did was that each student sort of got their own project, and then we throughout program was able to or were able to work on a project and work with different mentors, and kind of seeing how getting more involved in the research setting. And so for my research, per se in my lab, we focused on Activin A, and so specifically the Lachi lab. And so what my project was about was that I was interested in rheumatoid arthritis. And so, as you guys might know, briefly, rheumatoid arthritis is an autoimmune disease that primarily affects joints and connective tissue in the heart and blood vessels in both men and women. And so what my research involved with RA was that we took a look where we looked at this one protein called protein X that will make it nameless for now. We'll call it protein X. But what protein X does is that we through past research we saw that this protein X that there are high levels of this in synovial fluid and a serum of RA patients. And so what was also interesting was that in this case we also sort of looked at TFH cells, and we realized that in our lab we focus on TFH cells, which are also called follicular helper T cells, and we found out that there was a positive correlation of an increase of these TFH cells, these follicular helper T cells, with RA disease activity. And so through a lot of research we discovered that this protein X, that when there's too much of this protein X, that leads to more inflammation in the joints. As a result, right, that leads to rheumatoid arthritis. And so we wanted to kind of sort of just test that theory out. And so what I did over the summer was that I used a blocking antibody that specifically targets protein X. And so what we hope for by targeting protein X is that that block antibody would block protein X, which would cause a reduction in the concentration of protein X, which would ultimately reduce the inflammation. And so we used mice, and so we used this model called a collagen arthritis model, where in this case collagen is our antigen. That through again past research we found out that collagen is very or collagen per se is the antigen for protein X. And so what we did was that we used this collagen arthritis model. We had mice, so we had 20 mice total. We had two groups of 10 mice, and what we did was that we would, in this case, one group received isotype antibody, so basically pretty much that means one without antibody, and the other group received protein X blocking antibody. And so once we injected both of these antibodies, we gave the antibodies through IP administration every other day. And what also happened was that we also immunized the mice with this collagen, right? And so the mice had two shots of immunization. They had the first immunization on day 1, and then they had another booster immunization around day 21, and then they were then euthanized around day 49. And so what we hope for to see that when we use a block antibody on the mice, that your protein X concentration levels will decrease. As a result, they would have less swelling, which also indicates a lower clinical score. And so that's what my research is about. This was very important to me and it was very helpful to me because I was very interested in research, and so this was a great experience for me to get to learn more about immunology. So thank you guys for listening, and be sure to look at my poster as well. All right, thank you guys.